Hello everyone, my name is Shady Hermena and I will present the study with the title How to Manage Scaphoid Waist Fractures, Introduction of Pragmatic Pathway and the Literature Review of the Recent Evidence, conducted at Yeovil District Hospital. Scaphoid fractures represent 90% of carpal bone fractures and usually affect male population aged between 15 and 19 years old. Scaphoid waist fractures represent 70% of all scaphoid fractures. This study aimed to introduce a practical pathway to manage scaphoid waist fractures and measure its effect on practice efficiency. This is the scaphoid fracture management pathway introduced in January 2020. If no fracture visible on X-ray, urgent MRI scan is the diagnostic modality of choice. If fracture waist of scaphoid visible on X-ray, the next step is to obtain a CT scan to measure the degree of displacement. Fractures displaced greater than 2 mm should be reviewed in the upper limb fracture clinic for consideration of fixation. Those non-displaced or displaced less than 2 mm could be treated with a below elbow cast for 8 weeks and CT scan at 8 weeks if delayed union suspected at this stage. This study included adult patients referred from emergency department to virtual fracture clinic with suspected or confirmed scaphoid fracture. The first cohort involved those referred between January 2019 and October 2019, before the introduction of the pathway, and the second cohort involved patients referred between January 2020 to October 2020 after the introduction of the pathway. The first cohort involved 29 patients with mean age 37.9 years. The second cohort involved 33 patients with mean age 36.29 years. After introduction of the pathway, repeating scaphoid views on assessment in fracture clinic has reduced from 89% to 32% in the second cohort. MRI scan for suspected occult fracture without repeating X-ray has increased from 13.79 to 66.66% in the second cohort. The time for cast immobilization in patients approved to have no scaphoid fracture has reduced from 16.9 days to 3.6 days in the second cohort. In the first cohort, 5 patients had scaphoid waist fractures, all of them treated with below elbow cast immobilization. 4 achieved full healing, 1 developed non-union and had open reduction and internal fixation with bone graft. In the second cohort, 4 patients had scaphoid waist fractures, all treated with below elbow cast immobilization for 8 weeks. 1 achieved full union, 3 detected to have delayed union and had percutaneous screw fixation at 8 weeks. Despite more patients underwent surgical fixation in the second cohort, all of them had percutaneous fixation with headless compression screw. All patients in the second cohort achieved full union compared to the first cohort. Management of minimally displaced scaphoid waist fracture has been controversial. The recent SWFT randomized control trial included 439 patients who had been randomized between surgical fixation or 8 weeks cast immobilization with early surgical fixation in case of delayed union. The trial showed no significant difference in patient-rated risk outcomes between the two groups at 52 weeks. However, more serious complication in the surgery group. Main study limitations are small sample size, results are from one center, part of data collection was retrospective. The use of virtual fracture clinic and scaphoid waist fracture pathway has improved the clinical practice by reducing unnecessary imaging, unnecessary cast immobilization, and by using a timely fracture fixation intervention. These are the references. Thank you.